Hello everybody! As a follow-up to my last video on mast cell activation syndrome, this video will cover finding a good mast cell doctor, diagnosis including tests, and treatment. If you've missed any of my mast cell activation videos before, please go back and watch them so you understand what I'm talking about. Mast cell activation syndrome, or MCAS, is the inappropriate activation of mast cells. Something has happened to trigger that inappropriate response in your immune system. Most people with mast cell have very few foods, supplements, or medications that they can tolerate. We have rashes, sensitivity to light, sound, smells. The list goes on and on. First thing you need to do if you think you have mast cell activation syndrome is find a doctor. And that's actually very difficult to do because most doctors in the Western medical system do not truly understand MCAS. Typically, you will go to an allergist or immunologist, and many times they will make the diagnosis of MCAS based on very few tests. One of them is called tryptase, and the other is urinary N-methylhistamine. There's so many problems with these tests. First of all, for tryptase, it is an antiquated way of diagnosing mast cell activation. It is a good way for diagnosing mastocytosis. In fact, most people that have mast cell activation syndrome have a negative tryptase. And why is that? Because when someone has a mast cell attack, mast cells create allergic symptoms by producing mediators. And we have thousands of mediators, but we only have testing for like a dozen. So if you're someone that the mediator tryptase is not affected, you will have a negative tryptase. The other problem with these tests are that the mediators are released transitorily. They're there and they're gone, but their biochemical effects last for hours, sometimes even days. So testing is kind of useless. Then when it comes to the N-methylhistamine test, this test is performed incorrectly most of the times. That is because the urine needs to be refrigerated very cold for a 24-hour period. And somewhere in the process of collecting the urine over the 24-hour period or going to the lab, the urine isn't as cold as it needs to be, and the test is useless. So in many cases, if those two tests come back negative, a traditional allergist and immunologist will say that you do not have mast cell activation syndrome. And so everybody watching this video that has happened to, but you're still having symptoms, please continue to watch.